I'm going to pick up where I left off with the PA chest x-ray video and just say real fast something about rotation that I didn't touch on in the last video. So we can tell if there's rotation in an image by the sternal ends of the clavicles. Hopefully this is something your lab instructor showed you in lab, but I'm going to show you it here as well. We should also be able to see the T-spine faintly through the heart shadow if we've used the correct technique and correct procedure. And we should also be able to see fluid, if any, in the costophrenic recesses or angles, as long as they're on the image, which they must be. So here we have our chest x-ray. Now I'm going to point out the sternal angles or sternal ends of the clavicles. So here we have a clavicle or collarbone coming down. We can see real clearly that this is where it ended, if you can see that shadow. And I'm going to highlight it here in red. So let's follow this left clavicle here. And we can see it here. Now we have the spine coming down here, right? Here's the C-spine. Kind of see the T-spine. It kind of disappears a little, but we can still see some of it. And then here we have that carina there. This is a pretty good image to be able to see that carina, that bifurcation, which means this is the hilar region of each lung, right? But anyway, so if these sternal ends here are not equidistant or basically like kind of equal looking on each side of our spine here, that's going to mean we probably have rotation. And believe it or not, you may get sometimes where there's so much rotation that, let's say on this side, the sternal end ends here, this clavicle, and over here it ends like right here. That is not equal sides of the spine, right? So that means we have rotation. Okay, let's see. I think, sorry, the scroller on my mouse is terrible. Oh, here's an image too. Kind of helps to visualize. We can see we have rotation. Here's the midline of our spine, right? This is the distance between that left clavicle, and here's the distance between that right clavicle. They're not equal, so we probably have some rotation in there. And that's the sort of thing that the radiologist will look at. You also want to be sure to lift your chin up, minimize breast shadow where possible. But let's talk about the lateral chest position now. So we've fixed have everything completed, right? We're centered at T7. We already have our equipment kind of lined up with how tall the patient is. Maybe we still have our left marker from where we placed it from the PA. Generally, kind of the same KBP and mass for that lateral, things like that. So really, all we're going to have to do, as long as we still have that lengthwise, IR, is turn the patient to a true left lateral. Left lateral means that that left side is closest to the board, closest to the IR. Now for a lateral chest, this means that it places the heart even closer to the IR, further reducing the magnification. Because a radiologist likely will measure the heart on your x-ray, and if it's magnified, they might mistake that for an enlarged heart if they're trying to use an x-ray to measure the heart. Same thing, top of IR should be 1.5 inches above the shoulder. Sometimes when you switch from a PA to a lateral chest x-ray, you do need to move it down, the light and the board together. You need to move your whole light field and equipment down about 1/2 to 1 inch. And that's on some patients. You're going to have to use your judgment in lab and in clinic for that. Just keep that in mind that you may need to do that. Otherwise, the breathing is the same. Take a breath in, let it out, and hold it out. Let me use these instead. There we go. Let's see, a lot of the same anatomy to identify. Here we can see that hilar region. Now, if we want to talk about rotation on a lateral x-ray, let's see. So we can see that hilar region, or hilum, really well. So on this one, this is the hilar region, and we know that because we're seeing kind of a dark circle right there where I placed the dot. Now that dark circle is like looking down the barrel of a hose, let's say. So we have our water hose, and when we look at it from the side, the length of it, imagine that as the trachea, and the trachea is bifurcating into the lungs. Now let's say you took that hose and you're looking down the barrel where the water comes out. That's exactly what we're seeing in a lateral chest x-ray. It's as if we turn those trachea, that water hose, to the side. So when we can't clearly see this dark circle here, this is not the dark circle. That's part of the chambers of the heart. and so on. So we can't say that. That likely means that there's too much rotation. So in lab, I want you to try something, and I want you on the actual physical x-rays we have in our lab, use two fingers, your index finger and your middle finger, put them together and place them here. If you see a difference between one set of posterior ribs here and the other set of posterior ribs here, if you can place two fingers in here, and we see that the distance is equal to or greater than those two fingers, that is simply too much rotation. Over here we see they're almost superimposed. One side of the posterior ribs and the other side, they're pretty much superimposed. That's great. No rotation there. Here, if we have two fingers and it's equal to or greater, that's going to be too much rotation. You'll probably get a radiologist calling you back to redo that. This is an even better image to try and see, or to see that hilum, that like on-end hose that I was talking about, and it's right there. So that gets obscured if we have too much rotation. Okay, I think that's about it. Hopefully your positioning lab can help you quite a bit. Get these right. Take a look here. You can see some, mistakes that we all make at one point or another. Even late in careers, you make mistakes. Here, there's a marker right in the center. You might think, oh, that's just a small portion of the overall lungs, but absolutely not. There could be a small tumor under there or something. You got to redo this. Here we can see this whole chunk of the lung is cut off here. Just see, take a look at these, see if you can identify where they may have made a mistake.